Well, this is live on LMTV. We are live from the conference room of the Ministry of Health, where there is this joint press conference that is about to be addressed by the Ministry of Health and that of the National Public Health Institute of Liberia. Christian.
Thank you for responding to this important an impromptu press conference. This is not the first time that we have done this. When the World Health Organization and the Africa CDC first announced this outbreak as issue of continental concern and global security, we then sprung to our feet as a public health entity in August when I took over in order to begin responding. When we had our first two cases, we then called a press conference, and it was the same way on a Sunday, a weekend, when we had that press conference. I will first and foremost want to say thanks to the DRDE. Dr. Jito is not here. Alberta is here present, the Deputy Director, and the Division of Diagnostics, Public Health Diagnostics here at MPHIL for such combined rapid work in responding. Adding to that thank is the Ministry of Health, where we have then the county health officers and the county health teams that also then collaborate based on the structures that we have in this public health response. We just came from the lab and we were on this case, the particular celebrated case, if I can put it that way, for the last almost 36 hours now. We have a procedure called a 717 where we intend to handle, receive the information, let's just say address it within 7 days. We shouldn't go beyond that. We are able to address this situation just within 72 hours, less than 72 hours. And so we want to be thankful. That's why we are thankful to all the forces that combine, and this level of cooperation and collaboration is needed. Thanks also to the press for what an active case is, what a suspected case is, and we've got to grasp those things. And for a very long period, as you will note, there was no misinformation circulating because the press then actually grasps what these terminologies were, which were previously then misapplied. So thank you very much in that respect. In this particular situation, with this recent internet circulation of a suspected case and self-proclaimed, which we already hailed, and I will come to that. Again, the press has been very, very, very professional, again, in dealing with us as a public health medical institution. You didn't go out publishing stuff. You waited. We saw all your calls. We saw all your text messages, and we kept telling you we are addressing it. We are addressing it. Because for us, we address situation based on facts and the evidence. The evidence has to be scientific, and that's why we base on. If we say something is this, we must be able to prove it. And we will not just answer you as you've been relating to us over time. What triggered this press conference particularly is, again, this recent case. For a long time, the MPHIL has been responding to the outbreak, which you can attest to. We came from like 1 case, 2 cases, 3, 7, and then we went all the way up to 63 around December. And then we got 7 cases, then it was 70. In the course of time, all of those cases recovered. And in December, just shortly before December, we had a period where we had no case. We had 0 cases in the country. Then in After December, we started picking up cases again. We had about 7 cases, also 3 to 4 cases. Again, those cases were properly managed, again, given the kind of collaboration and the way our management system is. We then went to 0 in March. In March, we had 0 cases. Then we started picking up cases again. So to this date, the 2024 to May 11, 2025, we have had, and please be careful with these numbers as you've always done, we have had 652 suspected cases, meaning all the cases that we see that maybe on the skin, from the temperature, from all other symptoms, we say, maybe this person has something that that is circulating around. That's just a suspicion. So we bring that in, we take the samples from that person, and we test them in the lab. So what we receive in the lab, we receive about 572 of those samples in the lab, because not every case you take samples from. So out of the 572 cases that we tested in the lab, we had 100% testing rate, because that's why we brought in the lab and that's why we tested. So we brought 572 of those samples of those cases in the lab. Then we tested all 572 of them, giving us 100% testing rate, meaning before we were like 75%, due to some issues we had, chemicals, what we call reagents. So we were at 75, we were at 85. Then we started improving, thanks to the Africa CDC, the WHO, and the US CDC, and all the partners that have helped in this regard. All thanks goes to the Liberian government also, which for the first time, and among African governments, from our advocacy and other things, from the work we were doing, that has been one of the first governments to put a line item in the budget. And this effort came from, was enhanced by the advocacy of the Health Committee Chair in the Senate, Madam Vapila, and the Health Committee Chair in the House of Representatives, Madam Julie Weah. So we want to give them thanks also. Now, of those 572 that we tested, we got to confirm 78 to this date. So 78 confirmed cases. Okay. As you know, we said that that's the previous 70, 63, 65, right? And then they start adding on. So all of that is that total to this date. To this date that I'm saying, May 11, because we are at May 18 today. So the other bulletin will come up next week, which will then inform us as to other cases. So out of these 78 cases, we only have 1 active, right? So 77 recovered. So to this date, Liberia, to this date, this May 11, has only 1 active case. Now, interestingly and gloriously, from the work that we've done in combination, we have 0 deaths. So Liberia has no deaths. The concern comes when we have cases coming out of countries that we are bordering, and in the region also. Some time ago, for those of you who did not attend one of our NEPRC meetings, we did a comprehensive comparison with Liberia, South Africa, Sudan, DRC, of course, Congo, where we have most of these cases in Central Africa, and Sierra Leone at that time. At that time, Sierra Leone had only just 1 death. The comparison, we have total suspected cases of 652. For the Sierra Leonean bulletin that they put out on the 17th, again, we had our on the 11th, so they are 6 days ahead, right? Our next bulletin is coming up, and you can still compare that with these numbers we're giving you. We just did a comparison last week when we compared them head to head in our NEPRC meeting. There have total cases of 2,559 to this date. And we gave you this slide for your accurate records. We have total confirmed of 78, right? And they have total active cases, total new cases of 130. We have one active case, as we said, right? All of our cases have recovered. And we have one active case up to May 11. And our neighboring country has total active cases at this point of 1,918. And we'll give you this so that you have that for your records. We have 0 deaths. Our immediate neighboring country has 13 deaths up to May 17. For us, up to May 11. And certainly we have been following throughout this week. We also have not heard of any deaths. There are no deaths reported to us. So we can confidently say this figure remains at that until whatever may change. We have been communicating with the National Public Health Agency in Sierra Leone because of the pattern of transmission also, one of which we call cross-border transmission. We know what happened in our region during Ebola. We know what happened during COVID, but Ebola particularly, when the 3 countries, Guinea, Liberia, and Sierra Leone, were heavily infected. So from that point on, we've had very serious collaboration among ourselves. We, from the National Public Health Institute of Liberia, has been proactively engaging our neighbors. During the course of time, we have visited the Sierra Leone border, the border with Sierra Leone, at Bo, Waterside. We have visited other border points in Ganta as well, along on the Guinean side. We have done a cross-border. We have gone into the Ivory Coast, a program sponsored by WAHU, which is the West Africa Health Organization. And we did some exchange of information regarding how we are treating our cases here, how we are handling our cases, how we are going after them, how we are finding them, sharing our experience with our Ivorian brothers and sisters in the public health and medical arena. So we've been doing this. From the south, the WAHU, which is linked with WHO, there is an effort to also have this with Guinea and Sierra Leone. That is coming up. Until we saw this MPOX situation spiraling almost out of control in Sierra Leone, our neighboring country. So that is the level at which we are cooperating with our neighbors. The director of diagnostics just came in. We did say thank you very much for the sleepless nights. I left him at the lab and I came ahead because of, everyone else was waiting. So that's where we are. What we have done also in collaboration with the WHO, the Africa CDC, US CDC, is to continue increasing and enhancing our surveillance. Because we have to keep looking. Not only looking, but we have to keep testing also. So they have been helping us with the resources also provided by the Liberian government. It has helped us to launch certain other aspects of the program where we don't necessarily have to then depend on the partners solely. That is a very big plus for us. The Africa CDC, in fact, now has taken our model and have been toting it to various other countries to use the way we are responding. Just on Friday, we got a request from, I will not say the country, one of the countries to have us giving them our, reporting platform with the data and how we report and how we are responding and how we are managing our cases. So MPHIL, under this circumstance and declared as a center of excellence, it imposes upon us that responsibility to deliver. And that's what we have been making every effort to do. So that's one of our immediate responsibility that we have. We had a meeting. When they requested that at the last meeting, I said, well, I have to talk to the team and we have to agree on that because of data sharing and all of that. I cannot make a unilateral decision. And we came to a conclusion. So those are the efforts that we are making, leading some efforts, not just regionally, but on the continent as well. That is why, in terms of our testing capability, we want to thank and still, we request WHO and African CDC to continue to give us some reagents. Why? Because in our official communication with the National Public Health Agency of Sierra Leone, we have offered our services, our diagnostic services, and we have offered our sequencing services also. As you know, the WHO and Africa CDC jointly were able to, when we came in, create the situation whereby all the machines that we had here for sequencing that were not in use, we didn't have the capacity and all that, we were able to then combine and bring in that technology. So today, Liberia has the capability of sequencing all its pathogens. We're able to detect that we have clade 2A and clade 2B. We tested that right in country. We didn't have to send those samples out, and we don't send samples out anymore. Instead, we have been referred to for samples to come here. So that is a big plus for our public health system. It makes it robust. It makes it efficient. It may not be at the top, but we are making some strides. So, coming back to the case, we have consistently been carrying out awareness in the vernacular, giving our own limitations in terms of resources, and of course, repeatedly during press conferences and public health exercises. We have been explaining to the Liberian people the status of MPOX. We intentionally waited for a while so that we see how the message goes. Because it's a very fine line when you're telling people we have this number of cases, we have this number of cases. Some people may become so afraid and you create panic instead of creating awareness. So we've been playing that fine line game, and to the extent that nobody even knew that MPOX was here. Many people. I met with some of government officials and they asked me, what's going on with the MPOX? I said, do you know what the MPOX is in the country? They said, no. I said, but it's here. But we've been handling it the best way possible. Not to create panic, but to create awareness. Now, in the last 72 hours, there was a Liberian celebrity, and I would say celebrity because if it happened in the West, it would be a big thing for them. We overlook our own things here. This is somebody who makes us laugh. When for some reason, when you're sad and you open the internet and he pops up and start to joke, you take that joke and start laughing, you forget about your trouble, maybe temporarily. Nevertheless, those are our celebrities, and we must promote them. Now, see what has happened. We, in recent times, saw the upsurge of MPOX cases in neighboring Sierra Leone. There was a program, an event held there, where he participated and performed. And according to what he explained on the internet, you all got an explanation. I don't need to go through that. You saw what has been circulating. We want to thank him highly. Because why? It takes courage to come up with that. The same thing we've been doing. but we don't have it on us. So nobody, when we say there's MPOX, in fact, some officials have even denied that there is this disease circulating here. And we've had to go to some depth and breadth to explain that it is real. It's happening. Don't see because in the DR Congo, you know, the people are going helter-skelter, the numbers are so up, you know, 5,000, 10,000. The deaths are, I mean, you know, because it's not happening here because of the way we've been trying to handle it. What we have tried to do is to go ahead of the curve. That's why initially I think all of the pillars that are involved. I will come to vaccination. So we want to really thank him. We have a well-known celebrity in this building. I'll tell you. I will not call the name. We were talking about the situation some time ago, and I joked that celebrity, and I said, you know, because during COVID, I had my vaccination taken publicly, and, you know, it was all around as a means of, you know, encouraging the acceptance of the vaccine, right? And then in church, I, you know, also kind of talked to the church people and all that because we're in church and they were talking about the COVID. So I had to give some little awareness. And we gave these 4, what I describe as the 4 aspects of vaccine acceptance, you know. So where we have the 10 commandments, I named that the 4 commandments of vaccine acceptance. If you go on the page, you will see it. We won't go into that. So I said, you can help us with some promotion because not only do we work here, but, you know, with your thing out there, it could help. And just that celebrity sent me a lot of things, and I saw them and I said, okay, at some point, we'll risk communication, and then we'll do some videos, you know. So all of that was in process when we had a situation, and this celebrity comedian came out to say what he had, what's happening to him, what he felt, and how it was being treated, and how he was now treating it at home, rubbing the chalk and everything. We got a lot of questions. Number 1 question is the chalk that he put on himself, the treatment for Empox. I told him where the Africa CDC and the MPHIL and other MPHILs are heading now, we are looking at not only, you know, Western medicine, but we are going to look and dive into investigating our traditional approaches. Something must be in there, but we have to look at it scientifically. So we don't know, but this is the way it's treated. And so what we did then in this regard was to alert our surveillance officers, the county health officers. We sent the team, the combined team went, we located the patient, extracted samples, took the samples to the National Reference Lab just yesterday. So within these less than 36 hours, we've done all of that. We didn't rest. Early this morning when our group did their part, early this morning we got together and went directly to the lab. Actually, we expected them yesterday. You know, the other folks were at the lab. I said, if it comes in, just let me know, and then, you know, the rest of us will come. But it didn't come in, you know, on time. So the samples came in, and many other samples came in. So let us not just say this one sample. Many other samples came in, and they were tested. And out of the many samples that were tested, we saw that 3 of those samples, were positive. We sent those results out already. Mind you, we have 1 positive case still, right? 1 active case. So these 3 added to that gave us now 4 active cases because those are confirmed. We confirmed by testing. And that testing is called molecular testing for this kind of disease. So that's what we did. Okay. Between now and next week, we'll be receiving more samples, right? So we'll be testing still. So the number may remain like that. The number may increase. But as of today, we have 4 active cases of Empox in Liberia. We have 7 recovered cases. So the total number we have now, 4 plus 78 is what? 82. You can help me with the math? No. 82. We have 78. Yeah. That's 3. 81. Minus 1. Yes. So 81. 81, 82. 81. So correction, 81 cases, right? We have today 81 cases. Now, what we are not going to tell you, and I know that question will come, is, was that case among those positive? No. For confidentiality reasons, in public health and in medicine, we will not tell you. All we can tell you is among the many samples that we received and we tested, I think about 10 or so, 4 of those samples were positive. So we're only going to tell you, and we are only telling you how many cases we have. Now, what we have decided to plan to do, which has already started, is number 1. You also may have heard that there was a reported case from the military. So these cases that we are talking about is among those. That was already known before these other cases. So that one case you saw there probably may have been that case. And the EPI, the Extended Program on Immunization, the vaccine people. This is the director. What we did also was to ask the Africa CDC and the WHO in meetings that we attended that we need vaccines, because the vaccines can also help as a preventive layer. And that was approved, and we got the vaccines in country. We went through all the regulatory things that we needed to do, and the EPI director led that pillar, and we started vaccination. That was just a month, almost like a month ago. Yes, a month ago. The vaccination campaign was launched in Sinye. The Minister of Health and I were there to launch it. And we took the vaccine. And we did not cry. So they are witness to that. They were the one holding our hands. So we took the vaccine, and the vaccine acceptance, was very, very good, as the EPI director will explain to you later when I shift to him. So in the case of where we are now, what we are planning is, number 1, because you asked, what are our plans now? We do plan next week to visit the border again. This time it will not be just Bo. It will be along the corridor, that belt where we have the cases in Sierra Leone on the other side. So we want to visit that area and enhance our surveillance capabilities. We want to also enhance our cross-border surveillance, meaning on both sides, we want to increase that surveillance. They should be looking with sharp eyes. On our side too, we should be looking with sharp eyes and monitoring things. If for any reason they collect samples in that area that they may not be able to transport all the way to Freetown, Kenema, they can bring them right to Monrovia. We can have them tested here and send them the results. If for any reason they need sequencing to know whether there's any other clay circulating, because they also detected clay 2, we can do the sequencing here very rapidly and send them back the results. It's that kind of collaboration that we have established between the Ministry of Health here and the Ministry of Health there, the National Public Health Agency there, and the National Public Health Institute here. So it's a unison effort, which has been done on the One Health platform. Why? Because what we're looking at is what we call a zoonotic disease. It comes from animals and comes to us. when it changes the way it wants to come to us so that it can stay in us, that's how it does it. What we call mutation in science, it does all of that, change its genetic makeup in order to adapt in us. So that's how they live from the animals and come to us. And there are many diseases like that, Ebola, COVID, all of those. So that's one thing. We're asking our partners to help out with reagents for testing and reagents for sequencing. We are asking for assistance with surveillance so that more people can be deployed in order to actively carry out this response from our end and from the other end. Whatever the internal situation with the Sierra Leonean issue is, we're not here to say, and we don't actually know. We may have discussions and know some of the facets, but it's not our place, for that. We're only talking about what we can do from our end to help the situation. Because if we don't help out, it may spiral out, and it may infiltrate, and it will come to us, or it may go to Guinea, come from Guinea, come here. So we are looking at doing the same thing with Guinea as well. So from our Ebola experience, we are basing on that to address the situation in a holistic manner, not just in piecemeal and not just as a selfish country or individual countries, but as a region. So that is where our efforts are. I will turn over to the EPI because what we are thinking also is the strategy that was devised, those that have been confirmed, the people around them, we need to vaccinate them. So where we are coming from, the border along there, we are asking Gavi through this medium to please provide us more vaccines. The official request will come, but through this public appeal to please allot additional vaccines for us, because it's not just Liberia now, it's Liberia, Sierra Leone, Guinea. So if we are able to handle the situation within this triangle, it will not spiral out of control. We can be vaccinating in Liberia and at the same time in Guinea from what we have decided. So we are also looking at establishing cross-border IMS so that both the Sierra Leonean and us and the Guineans will have one little platform where we'll always meet and discuss and see what's going on in the other country, what's going on here, what are you doing, what can we do together. But if we start to do it one-on-one, it will be a little scanty and confusing. So that's our proposal to them in the letter we sent to both the the Africa CDC and our Sierra Leonean brothers and sisters. All of this information will then be transmitted. Everything we have done here will be transmitted to the WHO officially later this week to tell them that these are all the steps we have taken so far. We contacted Africa CDC, we contacted our Sierra Leonean brothers, this is what we are doing in the country, and then they will know how to assist us in whatever we want. So we want to thank all of you again, and I will pass on to the EPI director, who is the head of the vaccination pillar of the National MPOX IMS, NEPRC.
Thank you very much, DJ, for the intro. On behalf of our Honorable Minister of Health, Dr. Louis Boto, who is currently out of country on official assignment, she's attending the World Health Assembly, 78th General Assembly in Geneva, Switzerland. We bring you greetings from the Ministry of Health. Briefly, before the immunization pillar speaks, I would like to ask the case management, the County Health Officer of Montserrat County, Dr. Tape Kwali, to weigh in on case management, and then I will follow. Thank you.
So a shift will have to be made.
Honorable DG, thank you so much for organizing this press conference. So as the DG said earlier, the case from yesterday, so I'll just give a brief summary from yesterday. We just want to also I want to add my voice to appreciate our our celebrity.
Yes.
He has been very cooperative with us. Yesterday, after we received the information, we had some of our colleagues that were tagging us in the video, and we reached out to him. So when we got a call from him, he drove himself from where he was to camp yesterday at the Duboro Health Center, where we collected his specimen. And then the surveillance team was also there from the county that we did the line list, and we got the contacts that he had interacted with prior to his illness. And then this morning, blessedly for us, we also reached out to him, the team, the psychosocial team, and he agreed to be transported to the treatment unit where he's currently at right now, undergoing treatment. So we will continue to give you updates as it relates to treatment as we go along. But he's in good hands right now. He's at the treatment unit currently as we speak, and he's undergoing treatment. So I just want to throw light, and also again appreciate him because, you know, yesterday it was a bit difficult to get him on board, you know, most especially when it comes to diseases of such nature that will create public panic. You know, we tried to persuade him. He initially said no, but I know at some point in time we were able to convince him, and he agreed to go with us, and he's currently undergoing treatment. So I just want to throw that light before the EPI come in. So currently, just to inform the public that he's with us, and then he's undergoing treatment at the treatment unit currently, and he's in good hands. But as we go along, we'll update you subsequently. Thank you.
Thank you very much to our county health officer and the case management group. I would like to just
So she's the county health officer
to keep ourselves and our community safe. So we encourage all of our citizens to continue the good health-seeking behaviors. Number one, be very observant for any unusual symptoms, specifically rash on the skin, fevers, and headache. Should you identify this in any person, the first advice is to stay away from that person. Next, you should contact the local health authority, and this could be the nearest health facility, clinic, hospital, or medical center, that we have a member of the community who has developed these signs and symptoms. Can you come and help us? The health facility will reach out to you. They will talk to the person who is suspected of having the Empox disease. If there is strong suspicion, samples will be collected from this person and they will be submitted to the lab. At the same time, all of the other human beings who share a common space will be identified, and we'll call them contacts, pending the official results from the lab. Should we have the results from the lab that comes back and confirm and says, yes, this individual has Empox, they will be transferring the affected individual to a care and treatment center within the specific locality. All of the contacts who are identified now will then benefit from the vaccine. This is where the immunization payload becomes activated. I must hasten to mention that the Empox vaccine is a very unique vaccine. Unlike most of the vaccines that we already know we give to children and pregnant women, Empox is completely different. It is a vaccine that has been deployed in the midst of an outbreak as one of the countermeasures to interrupt the human-to-human transmission. So it will not be given to everybody. It will only be given to contacts of a confirmed case. And these contacts have further specific conditions to meet. They must be persons of age 18 years and above, excluding pregnant women. The second category of citizens who will qualify for the Empox vaccinations are individuals at risk. There are certain individuals within the community who, because of their line of work, are more exposed, have an increased chance of contacting the Empox disease. An example would be the health workers who are in the field, who are actively looking for the cases. The health workers in the treatment center who are providing care for the confirmed case. We have our security personnel at the borders who deal with cross borders and migrants. We have cross border traders, market women, fishermen, and truck drivers who may, because of their work, wake up in one city and travel to another city. So they are persons at risk and they will qualify for the vaccination. So just a few updates specifically with vaccine. Liberia received this vaccine from the Africa CDC in late 2024. We had to do training for our health personnel. Thanks to WHO who supported the training, we have been able to train the county health team of all of the 15 counties in Liberia on how to handle the vaccine, how to transport the vaccine, how to administer the vaccine, and what to look out for after the administration of the vaccine. To date, we have been able to vaccinate over 2,000 persons across 4 counties in Liberia: Grand Cape Man County, Nimba County, Grand Bassa, and Sino. With the recent information about a confirmed case in Monserrado County, we would like to assure the public that beginning tomorrow, vaccination will be offered to those who qualified for vaccination within Monserrado. Thank you. We can stop, and if there are any further questions or clarification needed, we'll be happy to provide them.
Okay. Thank you very much.
So this is ELBC Radio 99.9, and it's live on LMTV. We are bringing you a live press conference from the Ministry of Health and that of the National Public Health Institute. Let's take questions from journalists.
LBC, you mentioned about Liberia having 4 active cases. Do you mind telling us where those cases are reported from?
There's a question from journalists.
Monserrado and Sino.
So how many cases from Monserrado and how many?
There's one case from Sino, and the other 3 from Monserrado. 1 from Margibi, 2 from Monserrado.
Let's take questions and answers by journalists here.
Good afternoon. My name is Figo Mansari. I write for Heritage newspaper. That you mentioned clade 2A and clade 2B. Will you please break down for us from the scientific lab, or to break it down for us for the better understanding?
What happens is when you have these pathogens, right? This one's a virus. The virus is then classified into different types, subtypes. Okay, so for monkeypox virus, that's the virus itself, monkeypox virus. The disease it causes is what we call MPOX. So the monkeypox virus has types. You can call them clade. The scientific clade, this, that, or types. So variants. We got different way of calling them. For COVID, that time it was variants. Now this one is clade. So we have 2 main types, type 1 and type 2. Type 1 is circulating mainly in East Africa. So you have type 1A, now the subtype, right? And type 1B. For most of West Africa, you have type 2, which we call clade 2, right? And now you got clade 2A and clade 2B, the subtypes. That's all it is. It's just the type of that.
So still taking a question. That's not good.
My question has been turned to case management in terms of healthcare workers who are actually will be monitoring MPOX cases or suspected cases. Are there plans for training or of training programs for healthcare workers?
Yes, there's certainly plans. In fact, it's been done before. It's been already done before and will be repeated. There was a training in DRC some times ago, and actually, again, like we were saying, Liberia played a very key role there because of the way we were managing our cases here. So we came back, we exchanged experience, and then we came back and started training others. And there is a training program that will be going on again. We are going to train about 40 plus. Yeah. I want to have plus, so that maybe we can increase it. Yeah. So there will be that process of training healthcare workers for case management specifically.
In addition to that, we already have a pool of professional health workers who have been in the service way before MPOX. We have the experience from the Ebola, we have the experience from the COVID, and luckily for us as a country, we've recently renovated the National Infectious Disease Center, the Star Base at Free Zone. So this is a full hospital standalone that is there for infectious disease cases. So the cases that are confirmed to have MPOX within this particular geographical location will be moved there for treatment. And the staff there are trained and there are plans for additional upgrading of the skills there to continue to provide care. For those that are away in the county, remember we said that we have already provided training to all of the 15 county health teams, and each of the county have their identified treatment center. Thank you.
EOBC Radio 99 right now, still taking questions from journalists here at the press conference.
So, the report you just gave is from January to May 11. That means it's 7 days since May 11. Are we missing out something from the previous 7 days? Is it possible that we might have, more cases from 11 to 18 today? And also, you are reporting more cases from our neighbors, Sierra Leone. Is this something that the country should panic about, given the fact that we have these regular cross-border movements between our two countries? Thank you.
We reported up to
Edward Tama from the State Broadcasting. Let's not go to Christian.
Officially reported in the bulletin covers the period now you are talking about, and that's what we are reporting on in addition. So we are covering that period. We're only giving you that exact amount of cases, no deaths, and to add what we have to that, and that's what we are reporting on. Yes, I wouldn't say we should panic, but we should be concerned, given the historical nature of infection transmission in the region, particularly looking at our Ebola history and the immediate COVID transmission, which was a pandemic. So for any reason, we should always be concerned, for which the National Public Health Institute has, engaged in strong border surveillance, as always, but then we enhance it when there is this outbreak. At the ports, 0 ports of interest, we all know with the African situation, in many places we have porous borders. So there are things that that may be beyond our control, but we continue to do the best we can to monitor those official transit points, and from awareness that we are able to inform people when they see these symptoms, that they will be able to report them. And we have been pretty well doing well in that respect, because most of the cases that we have been having were cases reported to us from outside that we didn't, we didn't go out to see. So that shows from the RCI and awareness pillar what has been done. And of course, with the 0 cases, you can also see what has been done from the management standpoint. So it's a, like we say, it's a holistic approach, So yeah, we are concerned, but we are not panicking.
I'm concerned if a pregnant woman is infested with this virus, what is the risk of the unborn child?
Well, from the science, we know that there are certain viruses that are transmitted vertically, and there is that chance. So the best to do is, the earlier we detect, the earlier we begin to manage, the better it will be for the unborn child.
Yes, so my name is Johnson Batoma. I report for Troop FM. I'm concerned about symptoms. Usually during Ebola, during Corona, people around health practitioners will take about symptoms to look up to before you report yourself to to the healthcare or nearby healthcare center. So what are symptoms that we should look, Liberians should look up to before they report themselves.
Okay, and I kind of when I get to let that out for others to add, and Mr. You are Dr. You are added that, so we can state for emphasis. You restate that for emphasis purposes, okay?
In this outbreak, the suspicion for monkeypox should be heightened when we notice unusual rash on the skin of any individual. These rashes might be accompanied by fever, headache, weakness, loss of appetite. So once we see any unusual rash will be the red flag or the telltale sign, you should begin to think, because we are in an MPOX outbreak, you should begin to think MPOX, alert the nearest health facility. Someone in the community has rash on the skin. Can you come and help us to look at it? Is it MPOX or not? Then the health facility will come in and take it up for you. If they strongly suspect it's MPOX, they will take sample and send it to the lab. But if they see and they're convinced that it's not MPOX, they will still offer care for the patient. Thank you for the question.
So the rash that we're talking about are those bumps, what we call bumps, right? Those BB bumps. And for MPOX, you'll find it in the palm. It's different from smallpox. Somebody put something on, I had to tell them to take it down immediately, because they were saying chickenpox infection inside. I said, we never heard about that. Please take that down. And they took it down. A good old friend. So that's the difference. But anytime you see somebody start having those bumps on it, like you saw on the video, right? Yeah, that's a classic. Yeah, please.
So let me just add. The bumps will be bigger.
Bigger.
Yeah. It will not be like a chickenpox bomb, and it will have pus inside. Yeah. So if you look at the picture, it's a very characteristic lesion of MPOX.
And the reason why we are creating this awareness, because the case from yesterday passed to almost 3 facilities before he was caught. Mm-hmm. So imagine he went to this hospital, he was detected of something else, he went to another hospital, he went to another hospital, he went to 3 different facilities. So we just need to, adhere to everything as the DG said and Dr. Neiman said. There are classical signs of MPOX. If you see them as citizens, healthcare workers, they should raise concern so that we don't miss out on those cases. Because if we had seen him, he been from one facility almost like 4-5 days. So imagine those contacts that he came across. So he had been treated at this facility for something else, treated here. So as they said, the classical symptoms, let's look out for them in our communities, in our places of work, in the facilities we see them. We should alert the nearest healthcare centers or healthcare workers so that at least we can grab those people as soon as possible. So don't get to the way it got yesterday before alarm was raised.
Follow up on that. It's important that you don't give conclusions. These are, if you see it as suspected cases.
Yes.
Please. Yes. We don't want people to report that we've seen it and it is MPOX. Please, that's very important in communication. Right. So till it is confirmed, it is not MPOX. When it's confirmed, then it is MPOX. So don't report that we've seen somebody with these classical signs and then complaints of the symptoms also, and then you conclude therefore he or she is having it. So that's also going to misinform the community. Thank you.
Okay. So I'm going to give ready to yes. Right.
Yes. Thank you so much for this opportunity. And again for the initiative to keep the public informed about the developments about MPOX. It's very important for the public to know that MPOX is still a graded emergency. It means what WHO and Africa CDC called it that time, that name is still on it, on MPOX. And the interpretation of that, it means it is everyone's business, including the public. But it doesn't mean we should panic, like we have stated. The government of Liberia has the ability to contain this disease, and they have demonstrated so to date. Want to appreciate on behalf of WHO, want to appreciate Liberia for their capacity, for their seriousness and level of response they have put in place during this public health emergency. Liberia is one of the countries that surely have reported cases, but have maintained, to have the transmission chains don't go wild. So it's very important to appreciate that. In terms of case management, it's very important for the public to know that the country has capacity to manage the cases, and it is treatable. They are what they call countermeasures, what they do. So public should not panic that when they say you have this disease, you go and hide. These healthy people, they can look at you and decide and say, for you, for your case, we'll manage you at home. We'll manage you at home. For you, for your case, we'll take you somewhere. We give you medicine, good. You come out, you improve very fast, and we release you, you go home. The good news for Liberia, which should be, which should give, how do I call it, which should give hope to Liberians, is that in Liberia we have not reported and recorded a death, unlike countries like Uganda, DRC, and the others, where the deaths are actually increasing as we speak now. So what it means Liberians are cooperating. And this is the point I want to emphasize. Cooperate with the health authorities and the surveillance folks, please. A situation like we are discussing today, where we are looking at a celebrity, it means that possibly as many contacts could be out there. And looking at an urban case, it goes with complexities. It goes with a lot of challenges. Even in the war, when the war enters a city, the plan changes because the dynamics have changed. So I want to encourage whoever thinks is at risk, not because you interacted with the celebrity. You have heard the Public Health Institute director saying there are more cases which were positive. We don't know if that one is apart. But should you feel you are at risk, please reach the health authorities. There is a vaccine. That's the good news. Right. There is a vaccine, and the doctor said other at-risk groups are also considered for the vaccine. If I think the way I have been traveling, possibly I have been at risk, I'm at liberty to reach the health authorities and I tell them. And let's maintain this attitude of the public reporting. And again, we applaud the celebrity and other people who are self-reporting themselves, including the media. We applaud the media. The National Public Health Institute has another arm where they pick information. They call it surveillance or epidemic intelligence from open sources. These people keep listening to your radios. They keep seeing what you write on your social media. And from there, they pick information and they use it, to help the public. Whenever a disease is called a public health emergency of international concern, it means it is a public issue. And so, as a media, when you say, oh, in our village, 2 people are having this, how do you call them, pom-pom thing. When you treat it like that, you have done your role. No, you have played your role as a good citizen. So let's encourage everyone to report. Anyone will pick it up and to reach the rightful people, and you'll see them swing into action. And then the cooperation is very key. Lastly, as WHO, we don't encourage restrictions on travel and trade. We will not say that Liberia should close their borders. We don't encourage that. And we will not say that you say people should not come here for trade, or your people, your Liberians, should not go out to Sierra Leone because there are more cases to go and do trade. We don't encourage that. We only encourage preventive measures. If you go there, have the highest index of vigilance. Be vigilant. This thing is happening. You get it? And therefore, be careful about yourself and about how you treat yourself. There is one issue which is less talked about in Liberia, maybe in these West African countries. But where I come from in Uganda, it's a major driver of the MPOX transmission and the other countries there. The sexual transmission. Okay. At this time, again, I would encourage all of us to be very vigilant the way we go doing that thing. You get it? You understand what it means. You can have a way how you can package that message, but I can imagine, you know, you see me with those rashes and then you come to me. I can imagine that. But someone can be infectious, can transmit the disease when those rashes have not yet come out. So let's be very careful. And at this time, we can a little bit, you know, restrict ourselves to our wives or to our husbands or whatever. Meanwhile, we watch the situation until WHO, through the National Public Health Institute and the Ministry of Health, says the thing has gone. But as we speak now, the virus is here, the disease is here. When these people look out for it plenty, they may still report a few cases here, but important, the country has capacity to manage this disease. I thank you.
Thank you. So, before we go to the other CDC,
so ELBC Radio 99.9. There is a concern from
initially, Liberia received an allocation of 10,000.
One of the viewers online. So
and we have reported that to date we have administered over 2,000 of the doses. So this means we have 8,000 doses in country. Of the 8,000 doses, we have a little about 2,000 in Monrovia, and the remaining has been distributed to the subnational levels. Remember, we said we have already conducted vaccinations in Cape Mount, Nimba, Grand Bassa, and Sino. We have new cases in Margibi. So there are vaccines already pre-deployed in those counties. Tomorrow, for Monserrado vaccination, our vaccination center will be situated at the Duporo Health Center. Contacts and population at risk will be the one given the priority for the vaccination. Thank you.
Thank you. So let's move over to the Africa CDC, who will conclude this.
I think the previous speakers have virtually said everything required. But Africa CDC, we can be proud to say that we did not select Liberia as our center of excellency based on, what is happening in this response for MPOX and other emerging diseases, whereby there's a prompt action taken within the 7 days period, to look at, conditions and then manage as required. And there's a record. We need to be very, very happy as Liberians. I call myself Liberian now. You see, when there's quality, everybody is identified. Yes. So I'm also part of Liberia now. That we haven't experienced any death, and we should pray that that continues. And that is possible because of the management and the people involved. We have to give credit to people for doing a good job. And this cannot happen without the government stepping in to see it that this is not a country problem whereby the country ministry can do it alone. They count on partners and other support service providers to do it, including you, the journalists. I will add one risk group, that's you people. Because some of you are investigative journalists. You come closer to the source. So it's better you declare yourself and you get the vaccination so that you don't also carry it and transport it to other people. So it's very important that our vaccination team, we flag it so that we know that they are also part of the risk people, because they go there and maybe some of them will be even be curious to try to hold the T-SAT or SAT of the person. Please don't do that. Okay, minimal contact with the people. The other issue is Africa CDC will continue with the support to strengthen the health system in Liberia, not only in terms of emergent diseases, but surveillance across the board, cross-border surveillance, and we will still continue doing that. Your laboratory services to strengthen it will continue. And I'm happy that, you raised this concern in terms of the reagents also as a concern. As we are speaking, there's a process, in place whereby we're trying to see how best we can support Liberia continuously with some reagents. I would like to add in also the vaccines also. We should not wait till the vaccines which are supplied to Liberia is finished, and then we make a request. I prefer if request can be made now, so that we can look at it, the modalities, to make it available in Liberia, and then we don't wait till the ones we have is exhausted. The other issue is communities involved. Community engagement is key. The beliefs of people in terms of this disease and the way they are going to use their modalities to treat it. The more community engagement is there, we'll be able to look at all those things and then look at surveillance at that level. There is no country in Africa where there's no traditional medicine practice. And there's a saying in the Gambia where I come from, you either start with the traditional medicine or you end up there. So I don't know whether the same thing is here. So some might not even report to the normal system, but they will go to these healers. So through community engagement, distance, you'll be able to pop out, and then we can be able to trace it. And I think that will be very, very important if we do our community engagements thoroughly to ensure that these things are happening, not that those who are reporting. You mentioned one thing, DG, which I'm very happy. Most of these cases, 100%, any country you go to, did not come from the health facilities. They are from the communities. So if we forget that, then we depend on what the testings that we are doing at lab, then we will be late to get these things. So it's important we report accurately what is in the community so that we take prompt actions. I think that also needs to be emphasized by the journalists. We make sure that people know that it's our responsibility. The life we save is going to be ours. It's not that it's somebody's life we are saving, it's our own. So the more we report appropriately and on timely basis with informed decisions and they're guided by evidence, then we'll be able to share the information correctly. And then assurance is key, that there were conditions that we had in Liberia and other African countries where they say Ebola, COVID, say, oh, you have it, you die. No. We are saying if you have it, there's treatment available. So give hope to people that this is possible, and then there's medicine there. So the more you delay, the more you put yourself in danger. But the more you come earlier, the more we are also able to intervene and try to address the issue, and it might not spread. But without that, we cannot do it alone. Africa CDC, as a continental institution, we cannot do it without the people. In fact, our concept is, it is not us, Africa CDC, but the countries that we work in, this is your health system. What you want to do is what you ask us, and that is what we are going to support. We don't come with new inventions and say, this is our mandate upon you, you must do this. It's what Liberia health system have approved and say, this is what is happening. And I'm also happy to indicate that somebody mentioned about case management. This is a continuous process going on. As we are speaking now, the training we are discussing, how best we can have the first batch also again. No, another batch in Liberia to be trained on case management, only specific on MPOX. Those funds are available, and we are working as a team to finalize that also. So give hope to people. We have this and we have the capacity. The last one is, let's be proud of what we have. This is one issue we have in Africa. We are not proud of ourselves till we die. The day you die, everybody is talking good about you. That era should pass, because that dead body is not significant. The person that you are able to talk about his or her performance better, it will motivate the person, and it will also inspire others to take action. What good things we are doing, we should be respecting that. We need to market ourselves to know that we have the capacity. If Liberia have the capacity to do the sequencing here, they don't even have to send the samples to Dakar. Other neighboring countries like Sierra Leone and others are all going to count on it. This is why we selected Liberia as our center of excellence for the Western, for all the 15 member countries. We are saying the capacity is here. If other countries are sending in their samples, it's more credit to Liberia. And when you are reporting, these are things that you need to report. It's not politics. Forget politics. I'm anti-politics. I'll tell you that. This is reality. All right? They have the manpower. The challenges they have, how do we promote or improve on that manpower? And do we provide the service at other levels, either in the districts or the other counties, for ease of rapidly testing and giving information on the right time? That's key. Two, how do we ensure that these reagents are, in fact, I will move further to say, we should push the agenda for Liberia to be able to have your own agents manufactured here. Good. So we need to make sure that we have this, then we'll have the African dream we want. And with the support of Africa CDC and WHO and other partners, I believe we'll be able to achieve this, because that is the way forward. Rather, we depend on donors and the funds will be delayed, and then we might not be able to approach or meet our needs as required. So based on that, I will say thanks to all of you for this initiative, and it's important that people share the correct information. The journalists, I'll say thanks to all of you for making sure that you are available within, how do you call it, very inconvenient time that you are called within a short period, and you happen to come in. That shows your commitment. Please, let's emphasize that, let's encourage each other, and we share the information on a timely basis, and then we know what we are doing. Then with that, we'll be well informed, and we'll be prepared to take care of our health. Healthcare providers is not only to come and treat you, it's to give you capacity so that you are able to take responsibility of your own health. So there's no health institution that will say, come here for we treat you. They'll say, how best can you prevent yourself? And that's what we are emphasizing. Preventive measures so that we don't have some of these things going out of doors. And please, last call is, do not use only MPOX. This is across any other emerging condition. Get the facts straight. They have an open door policy. You can meet them at any time. They even have their communication officers. Approach them, and they will share the information as required. You know, the data sharing agreement, that's between Liberia and other countries. But internally here, you have a system in place which is commendable. All the journalists, you have access to their information officers or communication officers. You talk. And then there's what you call Liberia Association of Health Journalists. Good. So that platform also use it. Market what you have. And this is how we can make it better. For international data sharing, we are working with the government as we are speaking now, the legal part. We have what you call the data sharing agreement. Liberia have reviewed it, and we have sent it to our legal body in Addis Ababa. They will also look at it so that we agree in terms to say internationally what is going to be the means of sharing data from Liberia to other places as far as the Africa CDC perspective. So with that, I will say thanks to all of you, and this is highly appreciated. Thank you.
Thank you, Dr.
So, ELBC Radio, this is how we want to bring this broadcast to an end. But before we take leave of you, let's give you an update of what you need to know. So, as of today's press conference, there is 572 cases that were tested in the lab by the National Public Health Institute of Liberia, MOH-NPHIL, and you have 652 suspected cases, and you have 78 confirmed cases in Liberia. And of the 78 confirmed cases in Liberia, we have 4 active cases, and of the 4 active cases, you have 77 recoveries, and 77 recoveries. So at the moment we have only there is no death has been reported. Summing up the total number of cases reported in Liberia to 81 reported cases in Liberia, and so of those cases we have 4 that are actually active at the moment. And talking about Liberia's commitment or efforts that have been exerted by Liberia in combating the MPOX disease, there are countries, according to the WHO representative here, like Uganda, DR Congo, Sierra Leone, that have reported deaths across those countries, but Liberia have managed to contain and maintain the cases, not reporting any death. And the WHO have applauded the folks in the health sector, specifically Liberians, for cooperating. And Liberia is also prepared and well positioned in combating the MPOX. And they also urge the public to maintain the reporting. Mind you, they want people to actually report cases or signs that you may think are similar to the MPOX. So they encourage the public, both on social media, to maintain reporting. And once you are doing that, they will enable the folks from the Ministry of Health and the National Public Health Institute to gather information and combating the MPOX disease. And they also encourage the public to be vigilant when it comes to sexual intercourse. You should be very careful, because even if a person is infested with the MPOX disease, you might overlook it, wanting to have sexual intercourse with them. And even if they have recovered, it takes time for the MPOX to leave their body. So they also encourage the public to stay away from sexual intercourse. You are encouraged to venture around your spouse, many of you have a single relationship, because you don't know who you might be coming across and where they are from. And there are countries where the MPOX vaccines have already been saved, to include Grand Cape Mount County, Lima County, Grand Bassa, and Sano. So as of the case that was reported in Liberia, specifically Mosurale County, by one of Liberia's celebrities, Liberia or Mosurale County will now begin serving vaccine beginning tomorrow. And they also talk about community engagement. It is key to have the communities involved in this entire exercise, because mind you, there are communities that have a specific belief, and some will now want to take the health record or the medical advices, so to speak. They will say, well, we can handle it traditionally. They also applaud the fact that there are traditional medicine that are applicable, but since they have not reached a point where they can certify a particular traditional medicine, they are urging the public to report cases to healthcare workers and health facilities across the country. Well, so there you have it. At the moment, Liberia is reporting 4 active cases of MPOX, and we've been bringing you a joint press conference by the Ministry of Health and the National Public Health Institute of Liberia. My name is Aisha Niva. My colleague Damwa Fufana has been here behind camera, and this broadcast is live on radio. We say thanks also to Aaron Talu, who has been here making sure that we bring this broadcast to you. For and on behalf of the entire team here from the National Public Health Institute Conference Room, my name is Aisha Niva. Thanks, studio. You can take over.